February is American Heart Month, and we are at Virginia Heart right now with Dr. Trivedi learning about the importance of not putting off heart care during COVID-19. Let's first talk about symptoms. If people are watching at home right now, what are some symptoms they should be watching out for?
Well, when we talk about heart disease, there's a lot of different types, but specifically what we're going to be talking about now is the most common form, which is coronary artery disease, which is where you have blockages in the heart arteries. We're taught early on that the most common typical symptom of that is pain in your chest, particularly in the middle of your chest, and that's true, but it can be different types of things for different types of people. Some people get pain in the neck, in the shoulder, in the jaw. It doesn't have to just be in your chest. My colleagues are going to talk to you in a little bit about women and heart disease, and we know women have different symptoms than men. They often just have something as simple as shortness of breath. It can be even more subtle. Some people find that what they experience is a slowing down, that they, previously they could walk up this hill without any problems, and all of a sudden they're finding it difficult. They're running out of gas, and something is different. They realize something has changed compared to what they could do a few months ago. So if you're experiencing those kind of symptoms, let your doctor know, let your healthcare professional know. If they happen acutely and severely, go to the emergency room. Don't ignore them.
And some people may be ignoring that because they don't want to go because of COVID-19, but what's your message to them?
Don't wait. We're taking all the precautions that are necessary. Doctors' offices, hospitals, emergency rooms, we're doing everything we can do to keep you safe from COVID. But if you don't come in to seek care, we can't help you. I'm seeing people who unfortunately, are putting these off. They're convincing themselves that what you're experiencing was something else other than your heart. I saw somebody just a week or so ago who came to the hospital about 10 days after having a big heart attack at home. He convinced himself it was some spicy food that he'd eaten, and it turned out to be his heart. And by that point, the damage was done, and there's so little we could do to help him. If you come in early, we can intervene very quickly and stop a heart attack before it causes permanent damage, or even better, prevent it from happening in the first place. But if you don't come in, the damage is done, our options become much more limited.
Let's talk real quickly about the importance of research on the heart during COVID-19.
Well, as we've seen how critical research is to things like getting these vaccines out, it's equally critical for cardiovascular disease. All the therapies that we have right now are done or used because we did these studies 5-10 years ago where people took part in these research studies, and patients today are benefiting from that. So at Virginia Heart, we have a very active research program. We've been involved in 75 studies over the last 10 years. We've had 1,500 patients enrolled, and it's a great opportunity for patients to give back and to add to medical science.
You also have a lot of locations here at Virginia Heart, so if people want to get a hold of you guys, what's the best way to go about that if they're feeling any of these symptoms?
Well, if you're feeling symptoms right now, you need to put the phone down, put the TV remote down, and call 911, get to the hospital, get yourself checked out. If you're not having symptoms now, but you're worried about some things that may have happened before, you can go to virginiaheart.com. We have a list of all of our offices, our phone numbers, and you can contact us. You can also contact your primary care physician as well.
But the most important message right now is don't put off making that phone call.
Absolutely, kid. You don't want to put it off. We're seeing that happen far too often, and the results are not good.
Dr. Trivedi with Virginia Heart, thank you so much.
Thank you very much.
And we'll have more of Let's Talk Live in just a moment.